Today we will discuss the different types of lymphoma. You know the lymphoma means there is some swelling in the side of neck and also in your groin and sometime in also your armpit. When there is a swelling in your body, that might be the possibility of the lymphoma. So do not ignore any swelling behind or beside the neck, armpit and also into the groin. Let us discuss what are the different types of the lymphoma. Lymphoma usually two types. We call the non-Hodgkin's lymphoma and the Hodgkin's lymphoma. First we think of the Hodgkin's lymphoma. Hodgkin's lymphoma is since long back, since 80s. And this Hodgkin's lymphoma is one of the disease we can totally cure it. There is a types of Hodgkin's lymphoma. We define this lymphoma as a classical Hodgkin's lymphoma and the NLPHL called nodular sclerosis lymphocytic rich lymphoma called NLPHL. In the classical Hodgkin's group, we have a nodular sclerosis, the mixed cellularity, lymphocyte rich and lymphocyte depleted lymphoma. So whatever it is the Hodgkin's type of the lymphoma, your prognosis is very good. If you consult the hematologist, then you will be cured by 80 to 90%. But you remember that the diagnosis has to be done early. So if any swelling is there, rush to the hematologist, do your testing as suggested by the doctor and diagnose that you have been suffering from Hodgkin's lymphoma, then your future is bright. Look the other hand, that is called the non-Hodgkin's lymphoma. In the non-Hodgkin's lymphoma, there is a different types is there depending upon the aggressiveness of the cancer. We call aggressiveness because if you don't treat, the patient will survive in a short period of time. So if we consider the very aggressive, we call the Burkitt's lymphoma and also the lymphoblastic lymphoma. But the beauty of the very aggressive lymphoma is that if you treat it early, then it will be completely curable. So if any problem related to the gland, you should do the early blood testing, the lymph node biopsy testing, do diagnose the patient has been suffering from the Burkitt's or lymphoblastic, you will be cured in the future. Next we call the high-grade lymphoma. The commonest high-grade lymphoma is the diffuse large B-cell lymphoma, and this is a common type of the lymphoma in India. And in high-grade lymphoma, the treatment is there. Depending upon the stage, the cycle of the chemotherapy varies. So early diagnosis is very important. Apart from that, there is a T-cell lymphoma is there. We call PTCL NOS. We call ALK positive, ALK negative anaplastic glial cell lymphoma and also the angioimmunoblastic lymphoma. And into the low-grade variety, we call the follicular lymphoma, the mantle cell lymphoma, SLL, that is called the small lymphocytic lymphoma, and also the lymphoplasmacytic lymphoma. This is relatively we call indolent lymphoma because they are growing very slowly. The lymph node may be unnoticed for 3 to 5 years, but yes, you can diagnose it early if you have a lymph node and if you consult the doctors. So broadly, the lymphoma is non-Hodgkin's and the Hodgkin's. In the Hodgkin's, there is a classical and the NLPHL, and in the non-Hodgkin's lymphoma, depending upon the gradeness, that is very high grade, and also the low grade lymphoma is there. But you should remember that the lymphoma has to be diagnosed early, treatment has to be initiated at the earliest by the hematologist, then you can get rid of your lymphoma.